Hey everyone, can you hear me?
I can
Yep.
hear.
Yep.
Yeah, I can hear you, Ryan.
I can hear you.
Don't have too many people here in the in-person location at Michigan Works in Marquette, but we have plenty of people online.
Sounds like you're gonna have extra lunch for yourself.
Yeah, sounds like it. You gotta come out here and get some sandwiches, Nate.
I might come down there. I don't know.
Yeah, how's the air filter there?
Uh, Not sure. Probably not as good as it was yesterday. Everybody see my screen okay?
I can.
Yep.
Now it's probably harder for us. Yeah.
We're using the web-based app for the web-based Zoom here in person. It's harder to see.
Can you do a different view so we're not seeing
Yeah,
all of just
I'll
the
do it.
screen?
You close out that Google Chrome bar there too, though. Close it there.
I can see it better now. So that's better.
Okay. All right. Well, we're gonna get started. It's a little bit after 10. So we're gonna start out with introductions. We're gonna do just in the room introductions first, and then I'll switch to online. I'll do a roll call online. So when I say your name, introduce yourself. And I'll start with Emily.
Hi, Emily Bosch with KeyPad.
And I'm Ryan Soucy, Senior Planner with QBET.
Amy Stevens, planner with Marquette County. Deanna Johnson, Executive Director, Marquette County Habitat for Humanity.
Phil Britton, Program Officer at the Community Foundation for Marquette County.
Thank you. Now we'll switch to online. First I have Ed Legault.
Hi, I'm Ed Legault. I'm the Executive Director for the Delta County Economic Development Alliance. Sorry I missed some of you in the meeting yesterday in Marquette. I decided to hit a deer right outside of Rapid River on the way there. So I didn't make the meeting.
Sorry to hear that.
So was the deer.
Yeah.
I'm sure your insurance agent's not upset though.
No, it was interesting. I went to the collision place yesterday and I was dealing with insurance stuff, but he told me 70% of the cars he fixes right now over the last probably 4 or 5 years are caused by deer accidents.
All right, next is Andrew.
Hey, hopefully you guys can hear me. This is Ann with Invest UP.
Can hear you loud and clear. Thank you. Charlie Loper.
Good morning, everyone. It's Charlie Loper with the State of Michigan Office of Rural Prosperity. Thanks, Ryan.
Thank you. Good to have you. And Christopher Germain.
Hey guys, it's Christopher. You can't get rid of me, but I do have a different title now. For those of you who haven't heard, I did start consulting side business while I look for what's next. So technically, it's principal with Common Shores Solutions. But hi guys.
Glad to have you. Next, Holly Peoples.
Hi, everybody. It's Holly Peoples from UP Michigan Works.
Holly Toma.
Good morning, Holly Toma with USDA Rural Development.
Thank you, Holly. I'm going to skip over Jacob Boss and have him introduce himself in the next section. Julie Carla.
Good morning, Julie Carla with the Michigan Department of Health and Human Services.
Thanks, Julie. Kathleen.
Hi, I'm Kathleen Henry with the Superior Watershed Partnership.
Thank you, Kathleen. Next, Kathy Reynolds.
Yeah, good morning. It's Kathy. So I'm from the Greater Municipal Bay Partnership and also the Municipal DA. And if I don't happen to be on to the end, just a little news. I announced my retirement yesterday. So I'll be 6 months from now in March, plan on being done. So if anybody has anything they need from me or anything like that, or any questions, we'll be looking for a replacement here in the coming months. So
Congratulations, Kathy. That's sweet.
thanks.
I see Marquette County Land Bank. I'm assuming that's Antonio.
Yes, good morning, everyone. This is Antonio, Director of the Marquette County Land Bank. I'm happy to be here. Thanks for organizing, and happy retirement, Kathy. Congrats.
Next is Megan Morrison.
Hello, everyone. Megan Morrison, External Relations Manager for White Pine Copper over in Ontonagon County.
Great, thank you, Megan. And Nate Hebron.
Hi, everyone. Nate Heffron, City Manager, Nagani.
Thank you. And Nikki Bash.
Good morning. Nikki Bash with Great Lakes Housing Services.
Thank you, Nikki. And Ray Gobus.
Morning, everyone. I'm Ray Govis, Community Development Manager for the entire UP for the MEDC.
Great, thank you. Ryan Carey.
Ryan Carrick, Community Planner with QPAD.
Thank you. And Ryan Stern.
Morning, everyone. Ryan Stern, UP representative for the Michigan Building and Construction Trades Council.
Thank you. And Sam Stonelake.
Hey, good morning, everyone. Sam Stonelake, Business Development Manager for the MEDC, covering all of the UP, just like Ray.
Thank you. Is there anyone online that I missed?
Ryan, this is Donna. I had to jump off for a second, but I'm back. Donna LaCourte, Michigan Department of Ag and Rural Development.
Oh, great. Thank you. Nice to have you, Donna.
Thanks for having me.
And we had Victoria George join us. Victoria, can you introduce yourself?
Yep, Victoria George with Schoolcraft Tourism, Commerce, and EDs.
Thank you.
We got one more. We got one more coming in the door.
One more? Oh, we got Mindy. Mindy, can you introduce yourself?
Sure. Hi. Good morning. I'm Mindy Myers. I'm the Executive Director of the Dickinson Area Economic Development.
Thank you.
I am area.
All right. So looking at our agenda, I'm going to swap things around here and start off with the Eldercare study and follow it up with our RHP updates. We have Jacob Boss of Plante Moran joining us. He's with the Living Forward division, and he's going to tell us a little bit about the environment of eldercare, or demographics with eldercare, and some of the trends going on here. So Jacob, would you please introduce yourself, and I'll turn it over to you. I gotta enable sharing here. Okay, that's enabled and you're good to go.
Great. Thanks, Ryan. Pleasure to be here with you all this morning. My name is Jacob Boss, as Ryan mentioned, and I am coming to you from Smoky, Chicago. I'm with Plante Moran Living Forward. We are a senior living real estate development consulting arm of the larger Plante Moran firm. And so we specialize in helping owners and operators of communities, essentially anything with their real estate needs. And in terms of just developing all the way from having a concept of a project all the way through completion. So that includes, market studies in terms of seeing if there's enough demand, which is sort of my specialty, all the way through operations, building the community, operating it, the whole 9 yards. So I originally met Ryan presenting at the Michigan Association of Planners conference in 2023, I want to say. in Acme, Michigan. I gave basically the same presentation that he invited me to give this group here today, because I think it underscores a lot of the upcoming demographic challenges to our state, but also a lot of those are obviously exacerbated or persistent in the UP as well. So just kind of quick overview of our firm. We offer everything from strategic planning through operational consulting, financial feasibility, everything in between that it takes to get a project built. I've been with the firm for about 10 years now, so been here for a minute. But just a quick overview. We're going to touch on some sort of national and macro trends, and then kind of dive into some stuff specific to the Upper Peninsula. I'm originally from Grand Rapids, so I'm very familiar with Michigan and the state and everything. So this is something that's very important to me and is becoming increasingly dire over time. So I'm glad you guys were able to let me intrude on your meeting and share a little bit of details on this upcoming challenge that's going to be ahead of us in terms of taking care of our elders. So just a quick brief overview of just senior living as a product type, essentially, or as a entity. From 1700s all the way through 1980, it was a lot of community-based, just very small, a lot of families, intergenerational living, and then through the 1900 through 1980, it was a lot of nursing. But it wasn't until really 1980 that we started having senior living as it exists today, in the way a lot of us probably think about it, which is what's called assisted living, and that's a little bit less acute care than nursing, a little bit less institutional in the setting. So that was Sunrise, which was kind of one of the big operators for a long time there, but now has been surpassed by Brookdale and some others you might have heard of. But then it wasn't until really 2010 that we started building a ton of it. And that included now IL and some CCRCs, which are essentially the full continuum of care where, seniors move in when they're relatively young and have very little care needs, and then stay all the way through nursing and can get every service in the same community. So it's changed a ton essentially over the last 40 years, but especially in the last 15 or so is the reason we show you this slide. So originally there was only maybe 2 different options for seniors when they started needing care outside of their own families and friends. But now here you can see on this graph where we're looking at it starting at the youngest seniors at age 60 all the way through 90 plus. All the different types of care settings where they can receive the care that they need, starting with community-based services. So this is like your home health, telehealth, things like that, all the way through nursing and rehab and things like that. So it's a very broad spectrum. There's a lot of different sort of sectors that touch these our elders and that where they receive their care. So it takes a whole village, really. Some of the main types that you've probably heard about, obviously there's affordable. Generally, seniors enter here around the age of 80. There's not a lot of services typically included in these types of communities. They generally stay there longer than any of the other care types. A lot of times for the lack of a better option. It's generally just kind of a real estate product. There's, as I mentioned, not a ton of services, but it does offer some socialization through community spaces and living with other seniors as well. But then you have some of the more market rate product type that's a little bit more common. It starts with independent living, where seniors generally enter around the age of 80 to 83 and stay for 3 years, assisted living, and then assisted living memory care, and then ultimately nursing. And obviously all of them include a real estate component to them. They're, a actual physical community where the seniors go. But they have varying levels of actual services, and then obviously the rates to match. So as you have more services, obviously that requires more labor, which naturally is going to demand a higher price. So just kind of get a quick picture of who we're talking about when we're talking about seniors living in communities. A lot of times, you might hear 55 plus communities and things like that, and you start to think that, a senior is generally living in here around the age of 70 or so, but that's really not the case. The average age of move-in for the youngest senior living product, which is really independent living, active adult, obviously is another one you might have heard of. And that's usually almost more multifamily. So we're going to not cover that too closely today. And it's not super common in Michigan, frankly, or in the UP either. So 81 is generally the age that seniors move into. And that's going to be important as we move through here because you're about to see baby boomers are really just starting to get to this age threshold where they would likely move into the senior living communities. Assisted living about 85, and memory care is a little bit younger because people can start experiencing those issues a little bit earlier than some of the other care needs that put them in assisted living. So here's just kind of a quick, snapshot of the order of magnitude in terms of the generations that have been living in senior living for us. So preceding the baby boomers, obviously we have the silent generation. In 2020, they were our primary customers for senior living being between the ages of 75 and 92. So right in that 80-year-old sweet spot. Most of them were over that, so they were living in there. And then now comes the baby boomers. So the first baby boomer is actually turning 80 this year, 2026. So we are just starting to hit this huge demographic cohort where it just dwarfs that silent generation, as well as Generation X, which comes after it. But both of them still much larger than the silent generation. That our current supply is frankly struggling to be able to house all of those. So we have a much bigger wave of seniors coming down the pipeline than what we've had ever experienced before. So what does that look like? Just real quick demographically, over the last 20 years, this population has grown by about 400,000, or actually the number of units we have has grown by 400,000, not necessarily the population. Over the next 20 years, we're projected to need about 1 million additional units to serve these our growing seniors. So what we need to do double the rate of what we've done in terms of building these units over the last 20 years. We need to double that over the next 20. And unfortunately, that is not what is currently happening, which we'll get to in a slide in a minute here. So this slide, I think, really drives it home too, just kind of the unprecedented demand that's coming up for seniors. So this graph, as we move from left to right, is going from 2000 all the way out to 2060. And what these bars represent is the increase or decrease in the number of 80 plus population we have year over year. So in 2025, we're going to add 2.4 million seniors, or 80 plus population from 2020. In 2030, it's going to increase by 4.1 million in the country from 2025. So that is a huge jump. And as you can see, that's going to continue for the next 10 years after that. So just a massive growth rate in this 80 plus population, 113% over the next 20 years. In Michigan, that's 99%, which is triple what it was over the previous 20 years. So we are really, really on the very precipice of this huge wave of seniors that are about to start needing care. So what does that look like for the UP though? Same exact graph really, but now this data is specific to just the UP. So over the last 24 years, you guys have seen an increase of about at most 280 plus seniors each year at most, but some years obviously you might lose a couple. 2025 started experiencing really big increases of about 400, so that number actually doubled a little bit. But starting in 2028, the UP is going to add over almost 1,000 seniors, or 80 plus seniors, really those folks that are going to start needing additional care and not necessarily be able to be fully independent. It's going to increase by 1,000 every single year for about the next 10 to 13 years, which is just absolutely huge. I mean, it's more than has been added probably in the last 24 years. So it's gonna, you're probably just starting to hear about, from your friends and family and neighbors and everyone, that there's not a ton of options right now, but it's about to get a lot more dire over the next 5 to 6 years. So what does that look like in terms of the demand? Obviously with COVID, this graph is just looking at the number of seniors living in senior housing over the last 17 years. So it had been steadily increasing. And then obviously with COVID, we had a little bit of a drop as communities had to turn people away due to different, restrictions and other things like that. But now we are actually surpassed where we ever were. And now it's just going right back up on that solid steady trajectory up. Is really the only thing limiting the increase going faster is just a lack of units. So the issue, as I mentioned, we need to be building faster than we've ever built before. What this graph is looking at is the construction activity relative to the existing number of units out there. So just really a measure of how many units are we building each year. And as you can see in this graph, really we peaked in like 2018, 19, and then obviously with interest rates being higher and COVID happening, construction has gone down, like cratered to basically great financial crisis levels that we haven't really seen since 2008. So we are woefully behind in terms of adding the units we need to take care of our seniors. So the good news is though, we do have, obviously adult children that can help take care of the seniors. That's something that, we relied on for many years prior to senior living existing. But unfortunately for us, with birth rates declining, which I'm sure a lot of people have heard about here too, the generation following Gen X and, millennials after it, much smaller than the baby boomer population. And so what you see on this graph here is looking at the population that is generally the adult children of our 80 plus, and the ratio, the number of those people in our country relative to the number of 80 plus. So this one's saying in 2020, we have 6 people between the ages of 45 and 64 or adult children for every single 180 plus senior. So that, kind of helps take some of the burden off of our senior living communities where it's certainly no easy thing to do, but the adult child can help support their parent by, getting groceries or helping with some small care needs here and there. But basically over the next, and right now in 2025, we're at 5 adult children per senior. Over the next 10 years or so, that number is going to basically have almost down to 2.9 in 2045. So there's going to be very few adult children around relative to the number of seniors to offer that informal care. So a lot of them are going to their only option is going to be to move into a community or bring care into their home. So that means they need to rely on, outside of their own family. So what do those demographics look like, right? Well, the bad news is that entire population is also decreasing. So this is looking at a slightly different population than the previous one, where we were looking at 45 to 64. What if we break that out and say all of the workforce population, everyone between the age of 20 and 64, how is that population changing over the next 20 years? Unfortunately for the UP, the number of 20 to 64 population is projected to decline by about 10%. And over the same time period, the number of people age 75 plus is going to increase by 70%. And so what that means is the ratio or the number of people that are going to be in the workforce and working age population is going to decrease from about 5.7 or about 6 in 2020 down to 3.1 in 2040. So very few people to go around to staff these communities where the seniors are going to need to live because, there's just a lot more of them and they don't have the family necessarily to take care of them either. So what does that look like for our communities that can't find staff? That means they need to start bringing in contract or agencies staff to help support their communities, which obviously is not ideal because these people aren't in the communities constantly, so they're not able to develop those relationships with the seniors. They're a little more transient. It just makes for a little bit worse product and also a lot more expensive too, obviously, for the community. They're paying a higher rate for these staff to bring in because they can't find them locally themselves. So they're using these nursing agencies and things like that, which obviously need to charge a little extra. And so that's resulting in higher rates for our seniors, in addition to just not running on just bare bones staff. And so here you can see on this map, the counties shaded darker green, like up here in northern Michigan and over here in kind of the western upper peninsula. These are the ones where communities are really struggling with staff and needing to rely on these agencies, which generally are sending staff all over the state, wherever the need is greatest and rates are highest. So that the UP is certainly feeling this shortage of workforce population. In fact, 4 of the counties in the UP, all but 4 actually, so only these ones down here are utilizing at least some agency staff. And out of the top 26 of them are in the UP, which obviously is more than what you would expect. So also another indication of the labor shortage is how much of the labor for each county is being brought in from outside of that county. Obviously, ideally, you'd like people to live pretty close to their work, and so they'd be working in the same community that they're living in. But over half of the counties in the UP are needing to bring in nursing labor to staff their communities from outside of their counties. So pretty much all of them above here, Gogebic, are needing to bring in at least half of their labor from outside of the community, which is obviously very challenging. And on average, the UP is about 38% of the laborers need to be brought in from outside of the Upper Peninsula, which is pretty shocking. Just for reference, Oakland County near Detroit, that number is about 7.8%, which is still not ideal. But just to kind of give you a reference point, and then my home county, 12.6% in Kent County, Grand Rapids, are bringing in about that much additional labor from outside of their county to help staff their communities. Last couple slides. The other trend to mention here is just the decline in nursing homes and how many seniors are moving into those. So even as the senior population has increased, the number of seniors living in nursing homes is actually decreasing. And the reason for that goes back to sort of that evolution of senior living slide that we started with. There's just a lot more options now. Whereas before it was just nursing, now we've started to see a shift towards more community-based services, home and community-based services, decreasing hospitalization rates, and people are staying for shorter stays in nursing homes too. And then obviously nursing homes being the most healthcare oriented and the most serving the most acute seniors, generally they need the most staffing too. So they're the hardest to operate, especially in an environment where there's the least amount of, where there's fewer and fewer workforce population to go around. So in Michigan, that decrease in terms of utilization is about 33%. So what's crazy is the 65 plus population over from 2015 to 2022 increased by 20%, but the number of residents of seniors living in nursing homes is actually decreased by 20%, which is pretty shocking. The last thing I'll touch on is just the affordability of it. So not all seniors can obviously afford market rate senior living, especially as prices increase, as labor gets more expensive. And so what we have is what's called this middle income population. And so these are the seniors that can't afford that market rate product, but also make too much money or have too many assets to qualify for affordable solutions. So not able to move into any sort of subsidized communities. And so that's what this orange area represents in these graphs. And this is one of the almost the biggest group next to affordable in 2018, but by 2030, the affordable population is going to shrink significantly, and this middle income, which currently doesn't have really any options by definition, is going to grow significantly. It's going to see really the biggest growth alongside the high income seniors. And my guess is probably in the UP that you're going to see a very similar growth in this middle income population that don't really have a ton of options since they don't qualify for affordable. And then last slide here, 72% of seniors will not have the resources to be able to afford senior living in 2023 or back in 2023. So this is only getting worse. This slide's a little dated, but I can tell you this is not getting any better over time. They will need to tap into housing equity in order to afford it, but obviously not every senior has that. So the challenge here is going to be even more significant than it is for the entire senior population, which is already pretty dire. So with that, I'll stop sharing and turn it back over to Ryan unless there are any questions for me.
You
Hey, Ryan, if you're saying anything, you're on mute.
I'm sorry. I was asking if anyone had any questions. Mindy was saying something.
I was just going to reinstate the importance. I'm so happy to have this presentation today because, in Dickinson, we'll be doing our housing needs assessment and looking over the one that we were able to do in 2020. We saw a need for senior living, and it's something we really lack in our community. And seeing the data on the screen that it's just going to get worse feels like it's more of a crisis than like something we should just be thinking about, that there needs to be like real action. I know there's just a survey that's going around on economic development in Michigan and what our thoughts are on it. And I think we do a good job of bringing to light these things. But I think we have to be really serious about what that action step looks like. And I don't know what that action step looks like, and I'm happy that we have a meeting like this today to kind of figure that out.
As I talk to people who were closest to the issue, they've known this is an evolving issue for a long time, but we as a whole society don't talk about it enough, and this is really a significant crisis.
Yeah.
So, Ed, you had something? And I see Kathy came off video, or
Yeah, I was just going to say, I totally agree with Mindy there. And I've been talking about this over in Munising and Alger County for quite some time. Like many of the counties up here, our average age is 50. And it is just getting older all the time. And I think it just kind of slides by people. The years go by and everybody kind of forgets about it. But the fact is, a lot of people want to stay in their homes, or they want certain type of housing or services available. And the thing is, we can't keep waiting because waiting to fix it is not helping. It's just people are getting older. And I was just at that doing that demographic thing yesterday that I think a lot of you people did the presentation. And we are all like living on the edge, most of us, maybe other than Marquette, county, as far as decreasing in our population and that type of thing. And the thing is, we're just going to keep losing more people, whether that's because of death or that's because of people moving away. Because once they get to be, say, in their 60s or 70s, and they say, there are really no services, there's really no housing up here, I think I'm going to go ahead. Not only am I going to spend my winters away, but I'm going to go ahead and start leaving. And people say, well, that's not young people. Maybe that's not as important. Well, when a big swath of your population is 50 plus, it is going to be a very serious problem. I think that we really need to spend more time talking about. So that's my 2 cents.
Yeah. And for those of you that weren't familiar, yesterday at the UP EDO CDC meeting, we received a presentation from the state demographer, Dr. Jacqueline Butler. And that was a more general demographic presentation, but it hit on just a little bit of the senior population increasing. But this is a more deep dive into it, and we hope to go deeper. Does anyone else have any questions? All right, not. We're gonna lead into, well, I'm gonna thank Jacob for the excellent presentation, and I'm gonna go into
Thanks. I'll drop off, but thank you, everyone. Thank you for letting me intrude. Thank you, Ryan, for the invitation. And please don't hesitate to reach out if there's anything we can ever be helpful with. If you'd like the slides to share with anyone, just let me know. I'm happy to be a resource. So thanks again for letting me intrude, and have a great day, everyone.
thanks. So I've been looking at this issue since Jacob first shared his presentation in 2023, and been trying to formulate a study concept for our region. I recently shared it out to the concept out to partners, and we decided it should be a UP-wide study. So the question I'm trying to figure out with this concept is, does the region have the housing, supportive care infrastructure, and workforce capacity necessary to support a rapidly aging population into the future? And so the purpose of this study would be to help our region understand and prepare for a rapidly aging population. Get it out to the greater society and help them realize it's a significant issue and dedicating resources to it. So we hope to comprehensively evaluate the environment of housing, supportive care, workforce, service availability, and demographic change. And we hope to provide a common foundation for decision-making across providers, communities, and policymakers. And we hope to support aging in place, build justification for change, and support the priorities identified by organizations serving older adults, because a lot of them are working in this sphere already. So as I mentioned, a lot of them are working in this sphere already. CAP has developed a multi-year plan. I don't think their final draft has been published yet, but that's a great document that sets up this document, or this proposed document. We've done a joint regional non-emergency and medical transportation study. That was a couple years back. Recently, InvestUP contracted Upjohn Institute to develop a workforce dynamics presentation. A couple years ago, QPAD contracted with Connect Michigan to do a central UP telehealth study. Each of our regions have regional housing action plans that are tied to the statewide housing plan. And Michigan Works has a WIOA combined plan for the state of workforce in the UP. And finally, Dr. Butler, who presented to us yesterday, shared an additional presentation with me on the state of aging in Michigan. So that was really helpful too. So potential future impacts of the senior care crisis. More working age adults may reduce work hours or leave the workforce to care for aging family members. Workforce shortages may deepen as demand for healthcare and direct workers continues to grow. And demand for senior housing and supportive care services is expected to outpace available capacity. Housing shortages may worsen as fewer seniors are able to transition to age-appropriate housing, limiting turnover throughout the whole housing market. The cumulative effects may reduce regional economic competitiveness, quality of life, and the ability to attract and retain residents and businesses. So we have a housing crisis, not just for seniors, but for the workforce too. So how do we attract that senior care workforce if we don't have the housing to house them? So all these issues are interconnected. Senior housing, independent living, assisted living, memory care, long-term care, aging in place, those are all the various types. Along the supportive care infrastructure, we're talking about in-home care, transportation, healthcare access, care coordination. They're going to need more workers. Then we have the workforce capacity of direct care workers, nursing staff, home health aides, training pipelines, recruitment and retention needs. And then along the care continuum, we have gaps that exist in care, community-based supports that might be lacking, adult day health that might not be present in communities, and the need for respite services. So looking at the whole system, this assessment recognizes that housing affects the availability of caregivers. Workforce shortages affect access to healthcare, transportation affects access to services, and community infrastructure affects the ability to age in place. So if we examine these systems together rather than independently, we can better understand where the Upper Peninsula is prepared and where capacity is lacking, and where investments will have the greatest long-term impact. The Upper Peninsula is among the first regions experiencing the full effects of an aging population. We're just aging more rapidly than other regions. And as other regions begin to face the same challenges, eventually, competition for workers, providers, and investment will only intensify. We're going to be competing with other regions for those workers that we need. So it's important that we're growing them here at home and attracting them. So that's all I have for my presentation. I think, I've shared this concept out with a number of partners, and I think we have a lot of support. We've been tentatively authorized by MSHDA to use some of our RHP grant for match funds for the study. I'm planning to apply for the ORP grant coming up here, and that I think will take care of the first phase of the study. I've also worked with Plante Moran with my concept, and they helped me develop it into a structured scope of work, phased approach. So there's 3 phases to it. The first phase is more demographic heavy, and then the strategy follows that in the subsequent phases. So I'm looking to even build more support if I can. So Kathy, do you have anything else?
Well, I see Ed was on the first. I just got a quick question for you. Another thing I've been wondering about lately when it comes to all these topics is because whether it's AI or technology and those type of things is just so rapidly changing and will be extremely really moving at full force in the next 5 to 10 years. How is that going to impact, whether that be hopefully in a positive way, services and things that are going to be available to seniors? And I don't know how to quite put that all into words. I'm sure you could maybe kind of know a little bit what I'm talking about, but I mean, I'm sure there's many companies out there, whether around the nation or around the world, that are working on that type of thing. But because of the lack of healthcare workers and all those type of things, and that, how can technology help maybe with that gap? I don't know.
Yeah, that's a good question. Does anybody have a response to that? I think in some ways it'll improve efficiencies, but we'll always need the human element.
It'd be interesting to see examples of things. I mean, I know it's going to take some research for me, even me, to find out what that is, but it would be interesting to see examples of companies that are working towards initiatives towards that. You know what I'm saying? Because they see such a gap that they're going to have to fill that in other ways. So,
yeah.
Ryan, I just had one thing I wanted to share with the group, and maybe it's something we can add to your presentation, because I really think it's certainly a threat to the economy in the Upper Peninsula. When you take a look at the percentage of businesses in the UP that probably have less than 10 employees, what I see when I talk to many of the business owners in that area is lack of succession planning. Even if they had kids, they probably had less family members than in the past. In many cases, if their kids worked at the family business when they were growing up, they probably have no interest in taking over the small family business. What we see then is you have someone that's of senior age, probably not looking to throw a lot of investment into the small business to bring it back to maybe some of the things it needs, whether it's building infrastructure or whatever that looks like. If we don't come up with some help for these businesses to plan, um, they're just going to close. And what that happens then is if it's in the downtowns, you have gaps. Then you have to attract a totally different kind of business. Um, we've been fairly successful in seeing people maybe that moved away come back and either buy a business that was in place from someone or actually buy a building and bring their own business that they've wanted to do as a young entrepreneur and put it in place. But I think sometimes this group either, they could get hit with something health-wise that really throws them for a loop, and then there is no succession planning once again, or they just are in a situation where because of limited resources from a worker perspective, now I can't even do planning as the owner because I'm so involved in the day-to-day that God forbid something happens, some crisis, my business is going to close. So I don't know if we can somehow put in something in our plan to help businesses focus on succession planning as the owners get older. Workforce, once again, you've covered the shortages. And I just think if we don't better prepare our small business owners for succession planning, it's going to cause us a lot of heartache as we move forward.
Yeah, that's a really good point.
I second that. That's something that we're talking a lot about too at the Alliance with our Small Business Retention and Growth Task Force is succession planning. And I would just echo what Ed said about visiting the small businesses and seeing there's not much of that in place is a little frightening.
Yeah, we'll see how we can address that. It sounds like maybe we'll have to discuss that more in depth at a future meeting and think of ways that we can collaborate on it. Another thing that was recently brought up during one of my meetings sharing this out was the homeless senior population. And what scares me is in Jacob's presentation, that middle income cohort that cannot afford those types of care if they're unable to live in their homes and they can't find living arrangements, then is the homeless senior population going to explode at that point if we don't have the housing we need? If other regions are experiencing the same issues, then it's not like they can just go out of the region to find housing. They're going to struggle there too. So, yeah, that's another really challenging issue. Does anyone have anything else? Emily, is there anything in the chat?
So, Ryan, I just put something in the chat. So there is an organization that is actively working in the Upper Peninsula, the Michigan Center for Employee Ownership Group, and they have a lot to do with succession planning. I know that they got a real business development grant, and part of their focus is the UP. So they could be a resource for you potentially.
What was the name of that?
The Michigan Center for Employee Ownership, and I just put a link to their website in the chat. They also have some state of Michigan money, things like that.
Great, thank you.
You're welcome.
Share that link with.
For sure. All right, any last questions? Is this about? All right, moving on. It's hard operating two computers at once. All right, we're going to get to our RHP updates. So just a few RHP updates. So one of our housing work groups, Housing Now, who is its own coalition in itself, is hosting an event, Building What's Next. And that's going to be next Wednesday on July 22nd in the morning. It's going to be held at Marquette Commons. It's by registration only, so I'll send this presentation out after the call, and you can follow the link and join it. But at that event, you'll hear from Renovare and Wildflower Development Group on their development experience, project delivery, and lessons learned. You'll learn about the Heritage Trails housing development in Marquette Township and its role in expanding regional housing opportunities. Explore how Housing Now is working with partners to remove barriers and accelerate housing development, and discuss strategies and partnerships that can help address the Upper Peninsula's housing needs. Also, I'd like to share that QBAD entered into an RHP support contract with Christopher Germain. And he's helping me out with a few different things, the Dickinson County Housing Needs Assessment, and also the statewide housing plan 2.0. He's helping me with communications on that. He's developed a press release, talking points, social posts, and a QR code that we can all access at this link here. And so I'm hoping that anybody on this call will share it within their networks and get the word out about it. So on my call, RHP leads call yesterday with Mishra, we found out that the UP is overrepresenting in survey responses statewide. So we're ahead of the pack. Pleased to hear that. So as I mentioned, we're working on the Dickinson County Housing Needs Assessment. We're just getting started with that, collecting data. We're gonna soon be doing focus groups and getting out a survey to the county to share. So that's going well. And also, Schoolcraft County is looking to develop a housing needs assessment as well. So we're just figuring out the funding for that and hoping we get that together soon too. So here's one of the beautiful pictures Christopher put together. I put the QR code on here. Sorry, Christopher. So this is one of the many graphics that we have to share.
Yeah, Ryan, and we'll point out they actually were all updated about an hour ago, and they all have QR codes on them now. So that's why I ahead and did it. So
appreciate it. And I got it in another slide.
I just mentioned that I am comforted knowing that Christopher is still with us.
We all are.
So, yeah, just stayed like he left, but he's still here. Thank you, Christopher.
You can't ever leave.
I can't help it. It's like a thing. I love you guys too much. So.
All right, an update on my neighborhood with the state budget passing. There was a measure to restrict the HCDF Housing and Community Development Funds and Community Development Block Grants to narrow the uses. So it would be more targeted toward senior housing, but it would have cut out the regional housing partnership program. That measure was defeated, and so those programs have been maintained. Another thing I wanted to point out, we still have 5.5 million in our CDBG funds. It has been ridiculously under accessed, and that's because it's a challenging program to get into. But from what I've heard, it's if you apply for the funds, you get them. So a community could apply for the funds for a single family home repair program, kind of like Marquette County operates. It actually used to be a CDBG program, right?
We have funds that come every year for a emergency repairs program, but then we also had CDBG chill funds, which is the housing and improving local livability. CDBG. So that was a single family home repair program, and it was very challenging to administer. I'll just leave it at that.
Is that it? Only municipalities can apply for that funding, though, Ryan, is that true?
Yes, but developers partnering with the city can do it.
Or county? Or county?
We could have a third party administrator.
Counties too.
Okay.
Yep.
So you say remaining funds, so with the last round, I was told, like, because the city of Manistee did apply for one, and we were denied because they said they ran out of funds in our region.
That doesn't sound right.
For CDBG funds? Huh.
That really doesn't sound right.
You know, we had, last year we had, or maybe it was earlier this year, sometime in the recent past, we had a forum up in Gladstone talking specifically about the CDBG funding, and that was helpful, but I left still confused.
Yep.
So I don't, if there's opportunity for us to dive into that again, to really understand, because I know like those funds are still there because it is confusing to use and kind of hard to navigate. If there's opportunity for us to engage with our city managers and municipal leaders to attend something like that again, so they have an understanding. So I think part of the confusion is like we get a little education on it and then we try to educate another person, but we don't have the knowledge to answer the deep questions that come with that funding. So I don't know if there's something we could do about that.
So as Emily Leach was leaving the county, she offered to provide support and the resources that Marquette County has to model a CDBG program. So I don't know if those resources are still available to regional partners.
Like a step-by-step guide.
Yeah, because I feel like, you know, the presentations are good, but it's better to work with somebody who has a program and learn from them about that program.
Absolutely.
So Joe was like this first round of finding that essentially, right?
Mm-hmm.
And I'll just say that they are, like our grant was supposed to close June of 2025. It closed June of 2026 technically, but we still have not completed the closing documentation and can't do so because we don't have the chapters available in their program guidelines, nor do they actually know how to function through that closeout process quite yet. So that's where things are. And so we're doing our best to close it out, but it's still evolving and they still don't necessarily have everything available to get us to that finish line. Sure. And it should have been done to change it up. So
can we ask like the CDBG people to make it easier? Do that.
funds, right? Yes, they're interpreting federal law, and the translation of that has resulted in homeowners being very confused about what's available to them, staff that are administering the programs being very confused about how they can spend those funds, and then the process of that changing and ultimately not serving the people who we're trying to serve effectively or very fairly. And I'm just going to leave it at that because I'm about to get heated.
I see Andrew has her hand raised. Go ahead, Ann.
Yeah, I was just going to add, well, I have a question, but also was just going to add their Public Policy Associates was doing a study. Invest UP actually provided funding toward it, and I guess I have to look and see if it's complete. I know it's very close to being complete, but they were really trying to come up with what are some of the obstacles and hurdles with these programs and how could this be easier. Not that the state of Michigan has complete control over them because, as you said, they're federal funds, but that input from them might be helpful when that document is complete. And I know I brought Tira Karlstrom into that conversation to just share some of the frustrations, I guess, with administering a program. But I know Jerry also, mentioned in the chat, and something for folks to remember, that there are third-party administrators. You can apply for these funds to benefit your community without having to take on that work and essentially outsource the administration of those programs to a third-party administrator. And then my question is, that 5.5 million, Ryan, is that a UP-wide number or just the central region?
This is Region B, our region in the central.
Okay. I didn't think that there was that much left, but
was part of that grant we applied for, but we're pivoting to my neighborhoods, and I think that'll be better for the developer, but we were denied right in the CDBG funds. So.
Correct. Yeah. And that's why I'm wondering if the two projects, and maybe Antonio knows if he's still on, there were two projects that were kind of, I don't want to say given a green light, but given the yellow light to proceed further. And I'm kind of wondering, scratching my head a little bit, if that 5.5 doesn't include those two projects that were kind of approved to move forward.
Yeah, I can certainly speak to that. I think the overall theme here of CDBG being a very complicated grant to work with is true. We're helping run 3 current CDBG programs. One is an unoccupied rehab. The other 2 are housing infrastructure, and the one where the land bank is completing is DRR, demolition, reconstruction, rehab. I'm wondering the same thing. I think the allocation for the projects that I'm thinking about would be north of $3 million if they all, get grant agreements signed. So I don't know if they just haven't taken those dollars off of that tab, because 5.5 does seem kind of high. But if MSHA has been running an average of $1.5 million per round, and we haven't used them in previous rounds, that number would be inflated. So that's a good question to kind of go dive into a little deeper to figure out what is left. But if that's the pot, then that's a large amount of money for sure, which could result in other projects in different communities, for example.
Yeah, I thank you for that. And I pulled this information off of the My Neighborhood website. This was updated information as of June. So I'll talk to Misha folks about it, or if you want to, Antonio, then I'd be fine with that. And then you can report to us, the next Housing Now meeting, or and then I'll report it to this group.
Sounds good. I'll send you an email with the projects I'm aware of and the allocation rough amounts that we're targeting, and then kind of go from there. And whoever is in charge of on the MSHA side of reporting back, that'd be great.
Thank you.
Yeah, thank you.
But I agree though that we need to get more local familiarity, understanding, knowledge about CDBG so our local units can start applying for it for their needed programs. And I've heard that public infrastructure programs are a much easier route. They have to serve housing development that's being created, but that housing development has to serve the population that CDBG is able to serve. So
yeah, I mean, I see CDBG funds and my whole body goes, ugh. Like I just don't even want to like, and I know it's a tool and I want to be like, for the good of the order and to do my job, I want to understand the tool and be able to use it. But I just see those letters and it's like, my body is like, no, thank you.
Ryan, well, the new legislation that just passed should affect this funding also, right? And make it easier, maybe?
yeah, that's what I've heard. So you're talking about
The road to housing.
the road to housing, yeah, the federal legislation. Yeah, hopefully that does make things a bit easier. I saw Anne had her hand raised again.
Yeah, I was just gonna say something to keep in mind, like Ryan, in terms of advocacy, and I mean, really all of us as we get the opportunity, is just to impress upon MISTA that it sometimes takes us longer in small communities to get people to the point that they're comfortable to apply for these funds. I mean, it's really quite an exercise to get these projects ready and these municipalities on board to apply for CDBG funds. So my hope is that they would continue to roll those funds over in our region and not give them away because we don't use them. And I worry about that all the time, but it's just, I mean, you're dealing with a region that hasn't had a lot of development, with inexperienced developers, inexperienced municipalities. There are, several of us trying to help and trying to do good things, but it's really hard. And I think we should impress upon MISTA to have patience with us and bear with us a little bit and keep those funds rolling forward in our region so that we can kind of get our wits about us and get projects together.
Yeah, I agree. And what I think they need to realize too is, changing our systems and requirements really undermines our ability to maintain capacity. They moved it from MISTA to MEDC, back to MISTA, and that all confuses things a lot and, takes away our institutional knowledge when we lose a program for, many years and then that person's not there anymore and we gotta train somebody entirely new on it and yeah. All right, anything else on this topic? I'm gonna move on.
Yeah, just one more thought. I guess within the central UP region, we should probably think if who the vehicle would be, whether it's Housing Now or maybe an internal meeting. But I'm happy to share common practices and things that we've learned from the land bank side about CDBG. We're getting pretty well versed with housing infrastructure and unoccupied rehab and demolition, reconstruction, resale. So those are three of the activities. And the ones that I have not really dealt with internally or directly is your typical homeowner repairs and the manufactured housing. There's also activity eligible for that, whether it's, one house or multiple. But yeah, if that's something maybe for the fall we want to target, I'm happy to, share with other municipalities throughout our region what projects we're working on and maybe that, could serve to model maybe other communities that are going after the same projects. But to Anne's point, it does take time. So, we've been working on these three that I identified, for at least a year. and we're almost to the point where we're getting grant agreements signed, which is exciting.
Great, yeah.
Yeah.
I'll propose that concept or that idea to the work groups and in the various counties, and I'll let you know what they say.
Yep, and thank you whoever organized last year. I think Mishta did bring up their CDBG team or part of their team up to, I think it was Delta County. I can't remember the location, but that was good. If they could do that, keep doing that, that would be great. Just to kind of keep reminding us of the rules.
Yeah. And our presenter at that time was Chris Lucier, and he is no longer with Mishta. I haven't met the new person in his position yet.
I think it would be helpful too if they did that again, if Mishta came up and did another CDBG funds, if they could break it down. And I know they tried to do this last time, but like explain it to me like I'm 5, you know, like, right, like use language. Don't use all the language that gets so caught up that you have to be like a master of federal grants to understand it. Like if you could just break it down and be like, first you contact your municipality, then we'll work together and do this application. And then, you know what I mean? Like something that just like, I am not an idiot, but sometimes going through this stuff, it gets so convoluted that it's like, it gets confusing to the point where you're like, well, let's try to find something else. Let's try to work with a different program.
And I was gonna add that, in addition to Antonio being willing to speak to those, we would, I'm sure somebody from the planning team could speak in that kind of a way towards the homeowner repair program. And
cool. Yeah.
Right. It's as much as we've suffered, we deserve to put that out in the world to help other people not go through that same level of struggle. So
yes, thank you. Yeah.
Right. No.
Wait, one more question on my neighborhood. Sorry. So with the My Neighborhood program, are we expected to kind of have the same rules as we did the last round? Is it looking like it's going to be the same kind of monies available, like October date?
I'm assuming the October date is going to stand. That's been pretty consistent. I haven't heard anything yet on any program changes, but there have been a few in the past with the different rounds. So we'll probably find out about that soon.
I was on a meeting this week with Mishta and just a regular monthly meeting, and they did say October 1st would be the date. Funding would be the same. I specifically asked the question if there would be a change in how they, how and whether they score the applications, or if it would still be a date stamp.
Yeah.
And that was yet to be determined. Tanya indicated that the date stamp would still be important, date and time stamp, but that they were still looking for other ways to prioritize those.
Yeah, I can probably add a little bit to that too. I'm not sure who was on the mic there, but I heard the same thing, that the system they had for round 3 was basically time stamped, and not every project that was submitted first come first serve was ready, and now they're looking to find ways to make sure that the ones that are a little bit more ready or shovel ready or can be coaxed to get ready are actually in the competition. Rather than just having somebody that puts in a 50% app that, now they're subject to just holding that until they can kind of figure it out, which sometimes doesn't happen. So, yeah, I was actually glad to hear that feedback, because I feel like that would make those communities a little bit more consistent. And then also I heard that there was going to be an allocation. I think they reported this last year, for 25% of the money for the central would be allocated to areas outside of Marquette. Something to that effect. I don't know what the number was, but I was also glad to see that as well, just to kind of make sure that we're sprinkling the money throughout the region.
Great. Good. All right, on to our next item. So this is another thing Christopher is helping out with is the Invest UP led rent study. So Andrew and I and her intern Julia have been developing an idea for a rent study. And did you want to share anything on this before I launch into reading the bullets?
No, I'm glad to see the slide, and it looks like you've got. I guess why don't you go ahead through those, and then I can add anything if I think something wasn't covered.
Yeah, sure. So reliable current rental market data is lacking across the Upper Peninsula, making it difficult to accurately assess housing needs, support new development, and complete funding. You know, the ACS in smaller markets is notoriously unreliable. So I heard from Kathy about you know, how that data isn't her reality in her community. Existing public data sets often lag current market conditions. So it's like we have the 2024 data just current on the ACS, but that's 2 years old. So lack of community level data and provide incomplete picture of local rental markets. Communities, developers, and housing partners need localized data on rental market information to support housing strategies, development feasibility, and data-driven decision-making. The study would create a coordinated Upper Peninsula-wide rental market data set through direct landlord outreach. So we'll be doing interviews. We're planning to do a survey, providing more accurate picture of rents, vacancies, market pressures, and operating conditions than currently available. And our results would strengthen housing action plans, MSHDA and federal grant applications, housing readiness efforts, performas, and regional economic development by providing consistent, trusted source material of rental market information. And we've even heard from MEDC saying, you know, in a lot of markets, there's not good rental information.
It'd be good to have that. Yeah, definitely. I like it.
Yeah, and I took some a couple notes. Whoop. Just close my screen. So I had some notes on things that are included in the survey. We're going pretty in depth with this too, about, you know, things that aren't on the American Community Survey, like do you require first and last month's rent prior to move-in? Do you allow pets? What's the situation with your property insurance? I think Jerry put in a question about taxes. So these are all things that we'd be looking at. And did you have anything else you wanted to add to any of this?
Yeah, thanks. Good timing because I've got to run into another meeting here at 10:30. But just real quick, we know that, as Ryan said, we're going to do a survey. We know that surveys are tough sometimes to get responses from. I'm hoping that our intern Julia will do a lot of direct outreach as well. So some of you in the room, we may be reaching out to you in the near future to get landlord lists. I know many of you have those developed already, such that she can do some direct outreach there so we make sure we get good data. And also just want to really thank QPAD for participating in this. We're hoping to do a UP-wide study, of course, and hoping that both Whoopitor, no pressure, Jerry, and Eastern UP Planning will also be involved, so that we can really get something that'll benefit the whole region. And just to the point on MEDC, I know I talk with Ray and Jen Tucker quite a bit when they're looking at pro formas for different projects throughout the UP. It's really hard to know if what the developers are putting in those pro formas are accurate for that locality. So we're really hoping that this will help that effort as well.
Yeah, really excited to see this, Ryan and Ann. This would be a really useful tool. And I just wonder, as you said, Ann, about this survey data, if there aren't other interaction points with landlords that we could try to make sure that they see this this questionnaire, and whether that's thinking from applying for permits at the city or any other places that we can try to make sure that this is being brought to their awareness. So it's not just your poor intern trying to track down and send cold call emails to a lot of developers.
Yeah, that's been a central point of our discussions, how to reach them, find them. So, you're thinking the same thing as us.
Yeah, great to hear. And please include me if we can help anyway.
For sure. And that's it for my updates. So I'll just run through our grants, training opportunities, and events. So for grants, the Federal Home Loan Bank of Indianapolis still has their community investment programs. Right now they have down payment assistance available. So this is open to local banks who are members of FHLBI. So there's down payment and housing supply rate buy down. We always have the USCDA's investment programs, the Economic Adjustment Program and Public Works Program. Those are open on a rolling basis, and if you're interested in any of those, then get a hold of me. There's an interesting TA opportunity that was passed to me by MSHA. It's the Home Repair Network. The deadline is coming up on that. It's on July 24th. Cities need to be the ones applying for that, but it's helpful to have a coalition put together. So if you're interested, follow this link and reach out if you want to build a partnership. For training opportunities, Citizen Planner Online is virtual and self-paced. It's always available, but MSU Brad Newman here up in the UP is planning a classroom-based citizen planner, and it's going to be offered in Munising, which will be announced very soon. So I'm thinking sometime this fall. Next, CEDM is hosting the Affordable Housing Forum, LIHTC, Low Income Housing Tax Credits, and the QAP, Qualified Assurance Plan, which guides LIHTC investments. And that's on August 4th in Lansing. That's an event that's more oriented to developers, but might have some applicability for people in the housing ecosystem that deal with those low income tax credits. And then there's a Safe Routes to School training in Marquette on September 16th at the Peter White Library. And for events, MSHA's statewide housing plan survey is open, so I hope you all take it. I also need to take it. I haven't done it yet. And tonight, Senator Slotkin is doing a teletown hall on housing. I'm sure she'll be sharing news about the passage of the 21st Century Road to Housing Act, which was signed without, which was not signed. It passed without White House support. ORP, Office of Rural Prosperity, is hosting its Western UP Summit on July 21st in Hancock. And Charlie, if you're still online, I don't know if you have anything to share about this. assuming she had to drive. So I mentioned the Housing Now is building What's Next event that you have to register for. And then later, the summits, we have MEDA's Economic Summit on August 5th through 7th in Detroit.
Okay, can I make a mention there?
Yeah.
The Dickinson Area Economic Development Alliance is presenting at the MEDA Economic Summit on our Belong Dickinson program. So we're very excited to be there and share our living and working initiative that we started at the beginning of 2025 in Dickinson County.
Very cool.
So please come.
Yeah.
Please attend our session.
And Planning Mission 2026 is happening September 30th through October 2nd in Kalamazoo. The Michigan Municipal League Conference is happening October 7th through 9th in Traverse City. And the Michigan Downtown Association Annual Conference is November 4th through 6th in Crystal Mountain. Nate, did you want to say anything about the MDA or MDA conference?
I don't have any updates on the MDA annual conference at this point, but the MDA will be hosting a small UP-centric event in Marquette on August 6th from 10 to 1. We've already reached out to all the DDAs and I guess anybody else who is interested in being involved with that can contact me. If you don't have my contact information, Ryan can definitely get that to you. We'll be having the executive director come up and she'll be going through all the ropes and bells and whistles of DDAs, talking about MDA a little bit and how we advocate for DDAs. Lunch will be provided. In addition to that, those who are interested can sign up for a walking tour of downtown Negaunee, just kind of showing our project that we recently completed a few years ago.
Very good. I'll add that to this list. And I'll send it out after this meeting.
Sounds good.
And lastly, I have legislative updates. As I mentioned, the 21st Century Road to Housing Act passed. So in this bullet point, I have a link to the National Association of Development Organizations overview of the act. Also, there's a link to a podcast from an expert, Jason Jordan, from the American Planning Association that you can listen to. The My Home Program Act, that's the MML-backed bills. There's been no movement on those. Same with the housing readiness package. Actually, it looked like there was negative traction on that, or the co-sponsors were removed recently. There was a bill that was awaiting the governor's signature. She may have actually signed it today, or I'm not sure. I'll have to check. But it passed both houses. It's an amendment to the Housing Development Authority Act. It would create the Michigan Housing Opportunity Tax Credit. That would be complementary to the LIHTC credit, the Low Income Housing Tax Credit. It's a $42 million credit, adjusted annually for inflation. That mentioned it complements it. And it reserves funding for both new construction and preservation, with at least 30% of credits dedicated to rural communities like ours. It helps close financing gaps for affordable housing projects, making more developments financially feasible across Michigan. And something that kind of scares me right now is this proposed federal rule change by the Office of Management and Budget, which would amend the uniform guidance for federal grants. This would affect nearly all federal grant recipients. And we'll just read NATO's position on it. there's some pretty scary language in there about how they can claw back federal grants. This is similar to the executive orders that were issued last year, I believe. And there's some vague language in there about if your grant or sub-grant recipient uses language that causes significant reputational harm, then your grant can be clawed back. So I would encourage everyone to read this. Unfortunately, by the time I learned about this 2 days ago, the comment period had just closed that day. So I didn't, but I believe Eastern UP submitted comments, and NATO has been coordinating efforts on that. So does anybody else have anything they'd like to share? Any programs going on in your counties you want to talk about, or news you want to share? Anything in the chat? All right. Well, with that, I think thank you all for attending the meeting, and we'll see you next time. Our next meeting is September 17th from 10 to 12, and it's also virtual in person here in the Marquette, Michigan work. So maybe we can get a few more people here in this meeting room next time. But I understand because it's really smoky out and it's just awful. Oh, Ed has his hand raised. Go
Yeah,
ahead, Ed.
I'm sorry, Ryan. I kind of missed where we were going to be able to do updates. I have just two quick things. One, starting tomorrow at the UP Fairgrounds, we have a musical event, Uperfest. It's 14 bands over 2 days. It'll start tomorrow afternoon around 4. You can camp at the fairgrounds. They have food trucks, drinks, and should be a very fun event that some of the local bands are trying to get off the ground. So it should be pretty interesting. And then the other thing, I just wanted to do a quick recap on the Island Resort Championship. For those of you that don't follow the USA Today top 10 lists very often, earlier this year, the Upper Peninsula over places like Pinehurst, North Carolina, Myrtle Beach, those type of golf venues. The Upper Peninsula of Michigan was voted the #1 golf venue in the United States by the USA Today. And one of the things that really goes a long way in setting that standard is the Island Resort Championship. We just finished the 15th tournament, our 15th year as a sponsor. The Delta County Chamber is the presenting sponsor for that. Basically, we have about 220 volunteers that take on about 350 staff appointments to run the tournament. There's 144 golfers that participate in this Road to the LPGA tournament. And all the things that we do to support it, including businesses, there are 2 days of pro-ams in this tournament. So roughly 72 businesses or organizations take part in supporting this financially. Other Epson venues struggle to fill 36 pro-am slots. So it shows the local support we have. And then this was from actually the Epson's website that they put out fun facts about this tournament. And one of the things they said was they called this a tournament that sets the standard. The Island Resort Championship is not just beloved by players, it's been recognized as the best in the business. The tournament earned the Best Player Activation Award in 2025, beating out every other stop on the Epson tour. That honor reflects and creativity of the island resort team brings to the player experience each year, from off-course hospitality to from on-course hospitality to off-course programming like the Basters. For those of you that don't know, the Basters is actually a fun fishing tournament that the Island Resort and Casino puts on for the players during right before the tournament. But it was great weather all 3 days. Everything went very, very well. And my thank to any of you that participated or your organizations, and certainly the many volunteers that have come over the last 15 years to make this a very great success for not only Delta County, but the whole Upper Peninsula for sure. That's all I have, my friend.
Well, congratulations and great job to you and your team.
Thanks.
Hear that. All right. Well, if nobody has anything else, then we're signing off. Thanks all and have a great day. Bye.
Have a good day.